This should concern everyone. There's no doubt about it. The question is, can we afford it? And if we can't, how do we solve this problem? So no one here should pretend that we don't have a problem. But one thing that gets absolutely lost in the back and forth on Obamacare is we should be talking about health care. We should be talking about the increased cost of health care. And so if we could all just turn away from our politics for a minute and go directly to solving the problem, we'd go a lot further. So there's 3 ways we can solve this problem. We can address waste, fraud, and abuse, we can improve efficiency and delivery, and we can reduce the amount of health care that's being accessed. All of those things would go a long way. The RAND Corporation did a study, and the study said 12% of all the people in this country who have 4 or more chronic conditions cost the system 40%. What are we doing to address that? And Seema, when you look at this, have you seen an increase? North Dakota is a 50% state. We were as high as 80 at one point before the Bakken boom. So are you seeing an increase in the amount of federal share overall in traditional Medicaid?
Yes, I mean, I think that's the concern that we have, and Senator Johnson brought this up in terms of where we are with the GDP. Our actuary projects that by 2026, we're going to be spending $1 in every $5 on health care, so we're deeply concerned.
Right. But that's not what I'm asking. The state and federal government share the cost of the Medicaid program. So what percentage today, overall, nationwide, of the Medicaid program does the federal government
well, there's
spend?
There's different matching rates depending on the population that we're serving, right? So if we look at where we are over the next 10 years, our actuaries project that we're going to be spending about $998 billion.
But what percentage of overall Medicaid spending is that?
It depends on which program. If we're able-bodied adults, the federal government's paying 90%, and it depends on the match.
No, I mean, this is an important question. Because as we look at the economic challenges state by state, some states are wealthier than other states. If you have a large state that's not as wealthy, maybe you can answer this. What's the current FMAP on average in Texas?
I think the FMAP in Texas is probably a little bit 60, it's about 65%.
Yeah, and if that goes up to 70, you're going to have increased costs. So this doesn't help me much because I don't know what's driving this other than utilization. And so, you know, this is supposed to be a hearing about waste, fraud, and abuse, and I think that I share Senator McCaskill's point of view about the need to work with state auditors. They have real skin in this game. I had my director of the Department of Homeland or Human Services tell me that 28% of his budget went to pay for less than 3,000 people in nursing homes. Now that's something we need to talk about. And so instead of talking about all the things that we get bogged down into, let's talk about health care. So when you look at waste, fraud, and abuse, and you look at the programs, are you committed over at CMS, Seema, to responding and to having ongoing and consistent reports back to this group about the Medicare program or Medicaid program?
Absolutely, and I think that this year, since I've come to CMS, we've taken a lot of different actions. One of the things when we got to CMS, when I came to CMS, we inherited a backlog of GAO and OIG recommendations.
I don't think anyone should put any blame. We had 13 years of inattention. But we've got an opportunity today to take that first step towards solving this problem. And I want to make sure that you're working with GAO to respond. There's a number of GAO requests, but this is a very high priority for our oversight.
I completely agree. We've made this a priority in the organization. We meet with the GAO and OIG regularly. We've taken action. We've taken action on the backlog of disallowances. We've addressed some of the improper payments that were going on with the Medicaid program in California, for example, where we recovered by the end of this year $9.5 billion. We've also closed some of the loopholes in the designated state health programs up to the tune of $25 billion. The disallowances, that was $590 million that we went back and addressed. We're also doing some of our own audits around beneficiary eligibility, as well as managed care audits. We're restoring the PERM audits as well. We've started doing those. So we've taken a lot of action, but I agree that we need to do more.
DiDardo, let's assume that we run a perfect system and there's no waste, fraud, or abuse. How much do we reduce this number?
Probably marginally.
Yeah, and that's the point, is that we need to spend every dollar critically, but at the end of the day, that's not going to solve our problem with this explosion of Medicaid costs. This is a product of aging. Aging into the system. It's a product of an increased percentage of oldest who have depleted their resources, where we need to take a look at investments and research that's going to help people live in their homes longer and not access these programs. We've got real work to do here. And it frustrates me to no end that we don't begin to address the things that can, in fact, make a difference long term. And so I think that one of the next steps is, how do you deliver health care in states like mine? And I want to publicly thank Ms. Verma for working with my office and working with me to talk about rural health care delivery. I know the article that was in the New York Times that relayed a situation in Claire's home state was absolutely eye-opening, and it tells us we need to do better, especially for those seniors who rely on this program. Mm-hmm. But we've got to start identifying those things where we can actually save money, and save money long-term without curtailing people's access to care. And I want to just say one thing, it's disingenuous, and I'm not talking about you because you didn't make this decision. But it is disingenuous of this administration to say they believe in pre-existing conditions, protections in federal law for pre-existing conditions, when they are currently in court arguing that they're unconstitutional. There is nothing consistent about that position. Now, I understand the complications with pre-existing conditions and the complications with eliminating the individual mandate in pre-existing conditions, but let's not pretend that there is any commitment here from the Department of Justice to preserve pre-existing conditions as a protection for the American public, because you don't go to court and argue that it's unconstitutional if you intend to preserve that protection. So, and it's not your decision, but I want that on the record.